Okay, welcome all participants to our webinar lecture series on neck ultrasound. In this session, we are going to demonstrate you the neck ultrasound practice and demonstration. My name is Dr. Surachet. I am currently a director of Sonographer School at Chulapon College of Medical Science. Today, I would like to demonstrate you the neck ultrasound in details beyond thyroid. Neck ultrasound is considered a complicated ultrasound study because it contains lots of small structure of the neck inside, including small muscles, bone and cartilages, nerve vessels, and salivary gland. Lots of complex structure inside the neck. In order to accomplish and master ultrasound neck, detailed anatomy need to be emphasized and practiced and correlate with ultrasound. So in this session, we are going to show you how to relate anatomy on ultrasound and practice how to do some ultrasound in detail, including neck levels and salivary gland, as also like some of the major muscle structures. Let's begin about the session. In order to start scanning, we have to know the landmarks, basic landmarks that we need to recognize during ultrasound. When we scan up and down, we don't know what level is it. We commonly use the bony landmark of the neck in order to indicate which level are you scanning. So the basic bony landmarks of the neck you have to remember is there's 4 levels. One is level at hyoid bone. Second one is thyroid cartilage, and the third one is a cricoid cartilage and tracheal ring, which has different on ultrasound. So when we scan, we have to know which one is that we are scanning, so we will automatically know what level at the time that we place the probe. Start with the first one is the hyoid bone. Hyoid bone is a bone located deep inside the neck, and it's in the uppermost. It's above the thyroid cartilage. Thyroid cartilage we can palpate. It's called Adam's apple, very prominent. So hyoid bone is the first one that we need to know and locate. And then for the second one is a thyroid cartilage. It's a triangular shape cartilage, and then it's very prominent. And then the layman term is called Adam's apple in males. It's prominent in males. This is also the landmark for the scanning, and which has a unique appearance on ultrasound as well. So below thyroid cartilage is a cricoid cartilage. Cricoid cartilage is a complete ring around just beneath the thyroid cartilage. And then below the cricoid cartilage, there's a small ring of the tracheal cartilage, which has multiple levels. It's a dot like this. Anterior to the just beneath the cricoid cartilage at the maybe level first to third tracheal ring or tracheal cartilage, there's a landmark of the thyroid isthmus. Is located anterior to the tracheal cartilage or tracheal ring. Normally it should locate around first to third tracheal ring. Thyroid isthmus is the middle part of the thyroid and connect right and left lobe of the thyroid together. So then from the above, you have to know it's a hyoid bone. The second one is a thyroid cartilage. The third one is a cricoid cartilage, and others smaller one is a tracheal ring. So by recognizing from the above to below, you will know which level you are at. Okay, let's see how these bony landmarks look like on ultrasound. Firstly, we start with hyoid bone. Hyoid bone is deep inside the chin. When we have to scan, we have to extend a lot hyperextend the neck to expose the high oil bone at this spot. High oil bone structure, since it is a bone, its appearance is a arc shape of the echogenic arc shape like this. Since it is a bone, they have some of the shadow, dark shadow below, posterior to the high oil bone. You can also appreciate the structure around the high oil bone as well, since high oil bone is a landmark for muscle attachment, including strap muscle, including sternohyoid, mylohyoid, small muscle name of the hyoid in the name also have attachment to high oil bone. So surrounding high oil bone, there's a small muscles attached with the high oil bone. So going down a little bit, you can see the thyroid cartilage. The thyroid cartilage is a triangular shape of the cartilage. So inside of the thyroid cartilage, inside is a Larynx structure. So since the thyroid is a prominent and there's a ridge of the high thyroid cartilage, so this make lateral aspect of the thyroid cartilage have an air gap. When we scan, we have to push eliminate the air gap by put a lot of gel in order to fill the air gap, so we can visualize it well. So inside there's a triangular shape cartilage which has echogenic, but sometimes mostly don't have a shadow. And also thyroid cartilage has a lot of small muscle around and then attached to thyroid cartilage. So this is the structure that we need to know. So when we come with the high oil bone and then going down, you will see the thyroid cartilage. Okay, let's move to the next landmark. The next one is cricoid cartilage. Cricoid cartilage appears as homogeneous hyperechoic structures. When we do ultrasound, we can appreciate the horseshoe shape of the cartilage, but however, actually, cricoid cartilage is a complete ring. However, we cannot see the posterior wall of the cricoid cartilage since there's air inside of this level as well. Since the level is the upper tracheal level, that contains air. The air has a obscuration of the posterior shadow and dirty shadow like this, so we cannot see the posterior cricoid cartilage. So with this phenomenon, we can see only like the anterior wall and lateral wall of cricoid cartilage. So we can see like the U-shaped cartilage like this. This is a typical appearance of cricoid cartilage. So the cricoid cartilage level is important in many landmarks. With this cricoid cartilage, we can appreciate the level cut off of level 3 and level 4 of the neck as well. Surrounding structure of the cricoid cartilage also have a small attachment of the muscles around this, and also there's some air gap as well. When we do ultrasound neck around here, if we use a long sector linear probe, we need to put some a lot of gel to obliterate the air gap as well. Let's move down. Below the cricoid cartilage, you will see tracheal ring of the trachea or tracheal cartilage. The tracheal cartilage appear as a hypoechoic area of the cartilage, and also sometimes at the upper tracheal ring, we also see the isthmus of the thyroid, which is the central part of the mid part of the thyroid that connects right thyroid lobe and left thyroid lobe. If we see carefully with the tracheal ring, there's also like mirror artifact of the tracheal ring, since beneath the tracheal ring there's a tracheal membrane, which is the highly reflective structures. When the sound beam passes through, it reflects back and then create the mirror artifacts. So with this you can see cartilage in parallel line like this, but the actual or the true cartilage is the uppermost, the upper one, the first one. The second, the third one is appear as a Miller artifact from the tracheal membrane. So we start with the patient's hyperextended neck, and then we start with to show you the first part is the symphysis of the mandible. So we put the probe beneath the chin and then at the tip. You can observe symphysis of mandible, and then scan down, and down. We can see submental areas, and then go down further. And then the first bone that you see is the hyoid bone. As I tell you, it's a arc of the bone with the shadow. It's the first bone, and then it is superior to thyroid cartilage. So the hyoid bone is the first one that we need to know, and it is this one. So remember to hyperextend the neck, and then we extend it down. We see the bone prominent at the Adam's apple. You can see the triangular shape of the thyroid cartilage. This is very triangular, and it also you have to put a lot of gel laterally to eliminate the air gap, so you can see the thyroid cartilage well. So it's a triangular shape, and then we go down, and see, you can see the level of cricoid cartilage, which is the horseshoe shape, homogeneous hyperechoic cartilage. Actually, there's a posterior wall, but we cannot see it because of the air obscuring. And then going down, you can see the tracheal ring, which is hypoechoic with the Miller artifact like this. So when you reach the tracheal ring, you also see the upper tracheal ring, also see the isthmus of the thyroid, and also like tracheal ring have multiple levels, down. Okay, let's scan to see. We start with the cricoid level, and then scan around to see the tracheal ring. And then if you turn the probe perpendicular to the plane, you can get sagittal view, which you can see the cricoid cartilage, tracheal ring 1, 2, 3, as well as the tracheal membrane and its Miller artifact like this. In this patient, isthmus of the thyroid gland is in tracheal ring 1, 2, 3. And then if we go further up, you can see the uppermost is the thyroid cartilage, and with the membrane connecting to the cricoid cartilage. There's a connecting part is the cricothyroid membrane. It is the one that the landmark for the cricothyroidotomy. And then looking again, this one is the isthmus of the thyroid gland, and see, and then we confirm by going to transverse view like this. So then you're gonna get isthmus of the thyroid gland beautifully, and then look at it again, we turn perpendicular, and then see the isthmus of the thyroid gland. In this case, it's the level tracheal ring 1, 2, 3. And look again for the cricoid cartilage and the tracheal cartilage. So this is a cricothyroid membrane that I mentioned before. That is a anatomical location for doing the cricothyroidotomy. Okay, let's summarize in the sagittal plane around the thyroid gland. So the major study of the neck is a thyroid gland. Thyroid gland has two lobes, right thyroid lobe, and then the left thyroid lobe like this. And the mid part of the thyroid that cross the tracheal ring is isthmus of the thyroid. It's around here. Normally it should be upper tracheal ring levels. In some time, like in this case, if you correlate with the transverse and sagittal view, in this patient is isthmus is around tracheal ring 2, 3, and 4. Like this, mostly is in the upper part of the tracheal ring. So in this area, Posterior to left thyroid lobe, you can see the anatomy of esophagus, and then the lateral border of the thyroid gland is a common carotid artery. Okay, before we going to do the scanning, I have to introduce a structure that we need to see during the scanning. But if we consider to do the neck ultrasound, normally we separate the structure into suprahyoid level and infrahyoid level using the hyoid bone as a major landmarks. So in order to consider the suprahyoid that we're gonna start first, suprahyoid, the level of this above hyoid, we have sublingual space area, submandibular gland, parotid gland. Everything is above the hyoid bone is in this level that we need to scan, as well as the internal and external carotid artery as well. There's some several structures that we need to know well about the landmark of suprahyoid neck. So next is anterior belly of digastric muscle. If you see the position of the probe that we are placing, we put from the below of the chin and then point up, and then we're gonna see the beneath the chin. So the muscle that prominent muscle here, right and left side, is the anterior belly of digastric muscles, and the area space between these two belly of the muscle is the submental area. Anterior belly of digastric muscle is a landmark to separate level 1A and 1B. The midline part is the 1A between anterior belly of digastric, and then for the lateral part is lateral to anterior belly of digastric is a level 1B or submandibular space. And then move to another one is the mylohyoid muscle. Mylohyoid muscle is a sling of muscle, which is important structure which separates submental area from sublingual space, and then it's covered more to anterior and lateral, and then posterior there's some space that do not cover by the mylohyoid muscle. This is an important structure of mylohyoid that we need to understand. So everything is covered within mylohyoid muscle is sublingual space in this view. So everything superficial to mylohyoid is outside the sublingual space. Okay, the next structure inside inside sublingual space, the first one is geniohyoid muscle, which is attached about the mylohyoid, and then it's located into the midline position like this. Geniohyoid is a muscle that connect between genu of mandible or mandibular symphysis down to the hyoid muscles, but it's deep down into sublingual space like this. This is a fixed anatomical muscle and easy to see. And then if you go further down, you can see the genioglossus, which the muscle fiber is perpendicular to the geniohyoid like this. So this is intrinsic muscle of the tongue that we can see on ultrasounds. For the lateral aspect, we can see the echogenic area here is a sublingual space that contain the sublingual gland. So the gland is hyperechoic like this. That's contained with the gland and the fat as well. So inside the sublingual space and gland like this, there's a place where sublingual artery and vein travels here as well bilaterally. The sublingual artery is branches from the facial artery. We can see differentiate like this. So basically, in this view, you have to know the basic anatomy. Okay, let's start with to see the first one is platysma muscle. Platysma muscle is the thin sheet of muscle that cover the whole neck from supra and infrahyoid. It appears like a thin hypoechoic sheet of muscle and with the hyperechoic interface. It's below skin and subcutaneous tissue, and it covers almost entire of neck from supra and infrahyoid like this. You can see from lateral, right side, left side, upper and lower. It's almost always covered with platysma muscles. Okay, next we're gonna demonstrate the anterior belly of digastric muscle. If you scan to see, you can see the two bellies of the muscle just close to the body of the mandible, like this. It is anterior belly of digastric muscle, which has connected to the hyoid bone, attached to insert to hyoid bone. The space between these two bellies is a submental space. So for the posterior belly, I'm gonna demonstrate later. Next is the mylohyoid muscle. Mylohyoid muscle is a sling of muscle. It acts like a hammock that separates sublingual space and submandibular space, submental space out. So it's covered from anterior and lateral side of the floor of mouth. Okay, next is the geniohyoid muscle. Geniohyoid muscle, as indicated here, is deeper to mylohyoid muscle. It connects with the genu, is the pure submandibular symphysis to the hyoid bone. And then the deeper part is another muscle called genioglossus. It's one of the intrinsic muscle of the tongue, and area, the fiber is perpendicular to geniohyoid muscles. So if we look at the lateral side of geniohyoid and genioglossus, you're gonna see the sublingual space, which contains sublingual gland and sublingual fat inside. Next, we're gonna see in detail of sublingual space. If you move the probe more posterior, the inner part of the muscle is a hyoglossus muscle, is an important muscle. In the sublingual space, there's a sublingual artery traverse inside the sublingual gland like this. And this artery, when we open the color, we're gonna see the pulsation. And this one, sublingual artery, will enter the plane between mylohyoid and hyoglossus, as well as this plane is also have a deep lobe of submandibular gland, as well as the important structure of submandibular duct as well. So in case that we suspect submandibular duct stone, we have to look at the plane between mylohyoid and hyoglossus muscle, which is located more posterior lateral, and then look at the plane between these two muscles to look at the stone and submandibular duct. Okay, let's move to the first salivary gland scanning. The first one to introduce you is submandibular gland, which is located laterally. Normally, submandibular gland is located beneath the body of mandible. So the landmass for placing the probe is parallel to the body of mandible. When we first scan, we put beneath and then tilt the probe up and down to scan the submandibular gland. So in this view, you're gonna get long axis of submandibular gland. Let's see how the good image is to be obtained. In normal good images, you're gonna see structures around the submandibular gland, including this part. You're gonna see at the anterior aspect of submandibular gland, you're gonna see a group of muscles, and then there's another muscle posterior to the gland as well. So in the first one is a triangular shape in the middle here. This is a mylohyoid, and then there's a linear shape of muscle belly here anterior to the submandibular gland. This should be anterior belly of digastric muscles, and you can, if you tilt the probe up and down, you can see the connection between posterior belly and anterior belly sling across the submandibular gland. In this way, if you tilt and down beautifully, you're gonna get the part of the submandibular gland, and you can notice some part of the gland is deep down into here, down here beneath the area. This part is a deep part of the submandibular gland, and sometimes like submerged into sublingual gland, sublingual space. So in this view, you have to recognize how to scan submandibular gland, landmarks of mylohyoid muscle here, which, as I tell you, it's covered more anterior and lateral, but in the posterior part, it's gonna be not covered, and then it have the structure around here is a posterior belly of digastric instead. Okay, let's start. So we put at the body of mandible, and you can see the bone shadow like this. So and then we tilt the pulp down, and we can see like the submandibular lymph node and gland like this. So if we tilt the pulp up and down, we can see the posterior belly of digastric that's connect from the anterior belly of digastric. You can see the line connecting together. So the structure anterior to submandibular gland is mylohyoid muscles as well as anterior belly of digastric. So look at again, tilt and up and down. We can see the submandibular lymph node around and very well demonstrate of submandibular gland. And this one highlighted mylohyoid muscle as a triangular shape like this, and travel anterior, and it ends at the lateral part of the submandibular gland. So we just tilt up and down, and then next we're gonna demonstrate the connection between anterior belly and posterior belly of digastric like this. If you tilt down, you're gonna see the connection like this to demonstrate anterior and posterior belly of digastric. Okay, next we're gonna do parotid gland scanning. So we're gonna start with the position of the probe and then how to scan. For the chart axis, we put the probe perpendicular to the ramus of the mandible. Ramus of the mandible is the vertical part of the mandible that it looks like a leg of the mandible. It's form temporal mandibular joint to the preauricular region area like this. So we put the probe perpendicular and slide up and down to scan the parotid gland. And also part of parotid gland is lying in post-auricular region around here as well, and then form the deep gland as well. So we can scan transverse and longitudinal. When we want to do the longitudinal view, we have to scan perpendicular to this view, and then the landmark is the mastoid process at the posterior to your ear like this. There's a prominence of the bone that is the mastoid process and then it is the attachment of sternocleidomastoid. That's another landmark. So when we see on ultrasound, when we put here perpendicular to ramus mandible, you're gonna get a chart axis of the parotid gland. You can see the bony structure here is the ramus of mandible, of course, and then the muscle superficial and then attached to ramus of mandible. This is a masseter muscles. And then look at the parotid gland inside. You can sometimes see vascular or lymph node around here. So the superficial part, superficial to the vessels or retromandibular veins here is a superficial lobe, and then the deeper part, deep to retromandibular vein, is a deep lobe of the parotid gland. So this is the fixed anatomical structures, and sometimes you can see the muscle posterior to the parotid gland. It's usually be attachment of sternocleidomastoid to the mastoid process as well. Okay, another view of parotid gland scanning is how to scan the longitudinal view. The position of when we place the probe to do the longitudinal, we use the landmark of one side is at the angle of the mandible. The other side point the probe to mastoid process. So you can get the long axis of parotid gland like this. The landmark is parotid gland, superficial part and the deep part. The major landmark is the retromandibular vein, which will drain into external jugular vein. So this part you're gonna, and then we try to scan by fanning the probe to the right and left, and then you can scan the long axis of the parotid gland. Okay, let's start. We put the probe at the ramus of mandible like this. We can observe the masseter muscle beneath the ramus, and then you scan up like this. You're gonna see the superficial part of parotid gland, superficial to masseter muscle like this, and we scan up and down to see the parotid gland. Okay, let's see more posterior to see the bone prominent of mastoid process, which you locate posteriorly. This is a major landmark for to know the locations. So we scan the parotid gland, and then the muscle is posterior to parotid gland like this is a sternocleidomastoid, which will attach to mastoid process of the bone like that. Okay, let's move to see the deep gland of the parotid. We move the probe up and then slide the probe more posterior. We can see the parotid gland, the deep part of the parotid gland. But in this case, it's a fatty deposit a lot, so we cannot see it well. So we cannot observe sometimes we cannot observe the retromandibular vein in this case. So let's change the patient to see. Okay, let's change the patient to more slimmer patients, younger patient. We can see the landmark of retromandibular vein inside the parotid gland. Posterior is sternocleidomastoid and more anterior is ramus of the mandible. And then we can see, make sure that it is a retromandibular vein by tracking of tubular shape of the vessel like this. And sometimes we can see the lymph node as well around the parotid gland. And then next we move the probe parallel to angle of the mandible, ramus of mandible like this. We can observe the retromandibular vein in long axis. And then this is confirming it is a vein and drain into external jugular vein. Okay, next we move to infrahyoid level of the neck. So every structure below hyoid level is considered infrahyoid neck, starting from include thyroid level and cricoid level and anything below that. We start with the landmark of at the isthmus of the thyroid. Isthmus part is here, anterior to tracheal ring, and then connect thyroid gland from right lobe and left lobe. It's in the middle. If we see the isthmus of the thyroid, that means right and left lobe is the mid part of the thyroid of the right and the left as well. So in this view, the nearby structures in this level, we can see lots of things. So we start with the strap muscle group here. There's a group of muscle, small muscle group that cover thyroid anteriorly like this. When we zoom up in this strap muscle, we have several group of muscles. But the main thing that you have to remember is there's three muscles, including sternohyoid, sternothyroid, and omohyoid muscles, which we'll demonstrate here. So which one is which one? So the first one is the superficial one and locate more medially here. This one is the sternohyoid muscles. This one of the strap muscle. And the second one is sternothyroid. Sternothyroid is about the thyroid lobe like here, and they locate more deep to the sternohyoid here. So basically, the muscle that attached with thyroid gland is sternothyroid muscles. And the lateral one and more superficial is the omohyoid muscle. This one is considered one of the landmarks that we need to recognize because it's important to separate level 3 and level 4 of the neck. Okay, and next, the lateral landmarks. The structure that we need to know is common landmarks for vascular structures in the carotid sheath, which including common carotid artery and internal jugular veins. Also, there's a small structure dot-like here between carotid artery and jugular vein here. It is a vagus nerve, which is located within the carotid sheath. And the muscle more laterally, and the bigger one here is the sternocleidomastoid. Okay, next we move to more lateral structures. Move from midline to lateral structures at the infrahyoid level and also in mid-cervical level. As you can tell, we can see this is the cricoid cartilage level, cricothyroid level like this. And in this image, if you scan in the plane of the bone, you can see the transverse process of the cervical spine. You can see the cortex, hyperechogenic cortex with the posterior shadow. This is the outline of the cortex of the bone, which outline the transverse process. And you also see the prominence of the bone like this spike. This is also called anterior tubercle of cervical spines. So in most of the time, when you are at the cervical cricoid level, and if you see that anterior tubercle, that is very most prominent. This is a level of C6 vertebral body, and this is the anterior tubercle of the C6 with the anatomical landmark of at the cricoid level. And tubercle, anterior tubercle, and you also have a posterior tubercle. Between these two tubercles, anterior and posterior tubercle, there's a cervical nerve root traverse out of the transverse process like this. This is a landmark that we need to know. Sometimes we misinterpret the anterior tubercle as a calcified lymph node. We have to make sure it is the bony structure or not. So between the anterior and posterior tubercle of cervical spine, there's a nerve roots come out, and from level of C5 and to T1, this area, the cervical nerve root will collect and form brachial plexus to nervation of is a nerve to supply the arm. When they traverse from the neural foramen, they will traverse laterally, and also it has a muscle, the fixed landmark of muscle of anterior and middle scalene sandwich protect this brachial plexus. So I would like to introduce you about the anterior scalene and middle scalene muscles. Normally when the cervical nerve root go out laterally, and it's go along with the anterior scalene here. It's more, it's lateral but more medial. The other one is more lateral, is the middle scalene. So brachial plexus is sandwiched between these two muscles. This is another landmark to recognize the muscle. The one more medial is the anterior scalene. The one more lateral is the middle scalene, as used as the brachial plexus as a landmark to recognize the muscle. So there's another one. Longus colli muscle is a longitudinal muscle that is anterior to transverse process of cervical spine. This is area of the longus colli muscles. So this one, sometimes for the beginner, maybe misrecognized as enlarged lymph nodes. This is you have to scan up and down. If it is longitudinal, it is longus colli muscle, not an enlarged lymph node. Okay, let's start. So we start with to demonstrate strap muscle, which locate anterior to thyroid gland. So strap muscle has three part that we visualize. Let's zoom in, and you're gonna see sternohyoid, sternothyroid, and omohyoid like this. So begin at the first muscle. We start with sternohyoid, which locate more medial and superficially. So sternohyoid, when you move down, so it will attach the sternum and then go up and up. It will end to the hyoid bone like this. So this is sternohyoid muscle. Go up and down and then try to do transverse view. So you can see it travels up and down, and then these are longitudinal muscles. Okay, next we're gonna do the second one of strap muscle, which is sternothyroid. Sternothyroid is the strap muscle that attached to the thyroid gland like this. So it almost always cover the thyroid and abuts the thyroid. When we move up and down, follow the arrow up and down, it almost always cover anterior to thyroid gland. Okay, next we're gonna demonstrate omohyoid. Omohyoid is located superficial and more lateral to other strap muscles. When they move down, and then it will cross a common carotid artery. At this point is the level that we separate the third and fourth level of the neck, and we go up and down. When it go down, it turns to be tendon in the middle, and then turn to be muscle belly again. So it has two belly, inferior belly and superior belly. So the superior belly will cross the common carotid artery, which is the landmark to separate level 3 and level 4 of the neck. So next we're gonna go with the vascular landmark, demonstrate carotid artery system. When we move up, you can see the separation of ICA and ECA. ICA normally locate posterolateral aspect, and then ECA is anteromedial. When we use carotid bifurcation to separate level 2 and level 3. And in this view, if we see two carotid arteries like this, you're gonna go with level 2. When you see common carotid artery, that means you are in level 3 and below. Okay, we just scan next. When we see two carotid arteries like this, it's gonna be level 2, and go down. When it's a common carotid, it's level 3, and then go down. When the omohyoid cross, this is a level 4 now. You go and then go down until the common carotid artery joins the subclavian vein and enters into innominate artery. This is the orientation of the carotid system. Okay, next we're gonna demonstrate vagus nerve. Vagus nerve is a part of the nerve inside the carotid sheath, with also contains a common carotid artery and jugular vein. Normally it traverses between the jugular vein and the common carotid artery. If you would like to see it well in long axis, you just move it into the middle of the screen and then try to turn longitudinal like this. You can demonstrate the nerve fiber of vagus nerve very well on this view. Vagus nerve has some variation as well. Sometimes it's located posterior to common carotid artery. It's also possible, but normally it should be in the middle. Okay, next we're gonna go with bony landmarks. We can see the transverse process of cervical spine. And then the landmark is that the transverse process of C6 has the most prominent anterior tubercle like this. And then if you have draw the connection lines, you can see the transverse process, and with the tip very prominent of the anterior tubercle. And then there's a nerve root come out of the between anterior and posterior tubercle like this. This cervical nerve root will form the brachial plexus at the end. Okay, next we will focus on anterior and posterior tubercles of the cervical spine. So this spike of bony spike is the anterior and posterior tubercle, which connect from transverse process of C6. The most prominent one is the C6 level. Other anterior tubercle of other C spine is not prominent like this. Okay, next we're gonna look at the nerve root that come off the between anterior and posterior tubercle. This one is level C5, and if you see the tubular structure, hypoechoic tubular structure here, is a nerve root that come off cervical neural foramen like this. Okay, let's see the neural foramen. It's between the anterior and posterior tubercle of C-spines. You can see the nerve root come out and bundle together like this. This is the brachial plexus, which originate from C5 to T1, and then comes out from neural foramen like this. And if we look at the longitudinal view, you can see each of the neural bundle comes into the neural foramen like this. So next, there's just one thing to look at. There's a muscle that's lie anterior to transverse process of cervical spine. This is called longus colli muscle. It normally anterior to transverse process and posterior to common carotid artery like this, and run along the cervical spine like this. Sometimes we maybe misinterpret as a lymph node when we do the transverse scan, and sometimes it look like a round shape, and don't interpret as a lymph node. This is a longus colli muscle. So next we're gonna look at more laterally along for the brachial plexus. There's two muscles surrounded brachial plexus, including scalenes. If you see, the first one is more medial to brachial plexus is the anterior scalene, and then more lateral to brachial plexus is the middle scalene muscles. So basically, brachial plexus is surrounded and sandwiched by anterior and middle scalene muscles. This is a fixed landmark to understand these two muscles. So look at again, the brachial plexus and two muscles sandwiched with the brachial plexus is anterior and middle scalene. Okay, next, there's a broad, large muscle anterior to anterior scalene and middle scalene. That is sternocleidomastoid muscles. And in this view, you're gonna see very well demonstrate anterior scalene, middle scalene, brachial plexus, and sternocleidomastoid very well. So please remember this for remembering, because it's a good landmark to understand. And then if we follow up and down, you can see the brachial plexus entering the neural foramen in each cervical levels. Okay, next we're gonna move to posterior triangle. The basic scanning of this triangle, we have to know the major structures that are most important. At first, the posterior neck in transverse view, we're gonna approach the posterior triangle. When we position the patient needs to turn the head the other side to expose more posterior and lateral. So the structure you need to know is the boundary of this triangle, so you will know where you go, and then you are exactly at this triangle. The major landmarks of this triangle is the two muscles, including sternocleidomastoid muscles and the trapezius muscle. These two muscles is more superficial to other muscle in this area. So if you look at this picture, you're gonna know that sternocleidomastoid is more anterior, and then more posterior is the trapezius muscle, and this muscle is more superficial, and then the edge of these two muscles are the landmarks or boundary of this triangle. If you see this, the boundary of a posterior triangle, posterior edge of the sternocleidomastoid is the anterior boundary of this triangle, and then anterior edge of levator of the trapezius muscle is the posterior boundary, and then this space is a shallow fossa like this, and the floor beneath this space is a few muscle that we need to know a little bit. So there's two major muscle that we learned already is anterior and middle scalene. These two muscle is more close to sternocleidomastoid, and the other one is levator scapular. levator scapula is more close proximity to trapezius muscle. So if we scan, remember which muscle you are follow, sternocleidomastoid or anteriorly, and more posteriorly is a trapezius muscle. And then if you see the floor of this floor muscles, and you have to recognize which one. If it is close to trapezius, is a levator scapula. If it is close to sternocleidomastoid, it's more likely to be anterior and middle scalene. So when we scan, we have to see the edge of these two muscles to make sure it is a landmark of this posterior triangle. So look at ultrasound related anatomy that I described earlier. So we have to look at first which one is the edge of sternocleidomastoid or the edge of trapezius muscle. In this view of ultrasound, we just stitch the ultrasound image into one plane and then cover the edge of sternocleidomastoid and trapezius muscle. So in reality, the linear transducer is not large enough to cover both edge. So we just stitch it off to see the whole thing. So if we look at this, when we see the triangular shape of muscle on transverse plane like this means this is one edge of muscle. It depending on you put the probe. If you put the probe more anterior, it's a sternocleidomastoid, and the other one is the other edge here is a trapezius muscle. It depends on the locations. At first, this is if you put it posterior, this is gonna be trapezius muscle edge. So we just focus on these two edge. Sternocleidomastoid more anteriorly, posteriorly is a trapezius muscle, and then the patients turn the other side of the neck, and then we focus the area between these two tips of muscle edge, tips of muscle edge. So you can see the shallow fossa here. This is the posterior triangle. And then we look at the floor of this triangle. As I tell you, we see part of brachial plexus. This means this one is close proximity to sternocleidomastoid, right? This is anterior scalene. This is middle scalene. So the floor muscles of this posterior triangle more close to sternocleidomastoid is the anterior and middle scalene. And the one that close proximity to trapezius muscle, this muscle belly is a levator scapula. So what is inside this triangular posterior triangle space? So first one, we saw a nodule here. This is a lymph node. Lymph node is in this triangle. We look for lymphadenopathy. And also there's some minor structures that there's some nerve, spinal accessory nerve is traversed around this triangle as well. So, but in general, we just look for lymphadenopathy if there is anything, a lymph node enlargement in this level 5. And then in this triangle, since it is a triangular shape, the more upper aspect, the boundary is close together, and then it will widen when you move the probe down. So in order to classify that which one is a 5A or 5B, there's no landmark, definite landmark, because when we place the probe, we cannot see the level of cricoid to separate 5A and 5B. So we just estimate. Now, if it is wider, you're supposed to look at the 5B level. And if you move up and then the edge and boundary is close together, it's supposed to be 5A level of the lymph node, but you would like to classify it. But in general ultrasound, we don't separate much. We just I just put level 5. Okay, let's start scanning. So we follow the sternocleidomastoid muscle, and then you have to recognize it's a sheet of muscle, and then we just need to focus at the lateral tip of this muscle, because this tip is the anterior boundary of this triangle. Let's see the muscle up and down. So it's a more anterior. Then if you see much of this muscle, that means you are more anterior. You have to move lateral and more posterior, and then follow this muscle. So the edge of this muscle is anterior boundary of this triangle. Okay, next we see the other edge of the muscle, which is a trapezius muscle. You can see we have to extend the hand more posterior, and you see the edge of this muscle is a triangular shape. And then the muscle close in proximity but beneath is a levator scapula muscles. If we scan up and down, so we can see the posterior borders of this triangle using the anterior edge of the trapezius muscle as a landmark. So we follow up and down. You see the position of the probe is more very posterior to the neck. Okay, let's see the whole picture of the level 5 of posterior triangle space. So we look at the edge of this muscle. This is a trapezius muscle, and the other one is sternocleidomastoid. And then the space between these two edges is the posterior triangle or level 5, which is a triangular shape, and then with the wider base below, and then the tip of the angle is a narrow up. When we scan down, and then this space is wider, and then within this space we have to look for lymph node like this one. We have small lymph node, and then go more down and down. Here this another one, close proximity to trapezius muscle. We look at the whole thing, this area to area. You just scan up and down to see the whole picture of this space. Look for lymph node and other masses in this space that will complete the posterior triangle scan. So next we're gonna see more about the levator scapula muscle, which is close proximity to trapezius muscle. So this muscle, if you scan down and down, so it's go down and then attached to the scapular wing posterolaterally, and if you go up, it will attach the cervical spine transverse process. So this one is one of the flaw of the muscles that is we see all the time when we scan posterior triangle. Okay, let's move to the flaw of the muscle close to sternocleidomastoid. So this is the landmark of anterior and middle scalene, which are sandwiched with the brachial plexus. And we review again to see the relationship. And see, so it is an anterior and middle scalene as a floor, and in close proximity to sternocleidomastoid. Okay, let's see the whole picture of the floor of the muscles. From anterior to posterior is the anterior scalene, brachial plexus, middle scalene, and also the last one close to trapezius is the levator scapulae. These three muscles is the floor of this posterior triangle space that we need to know the structure well, and in order to understand how to scan. Okay, we just finished the demonstration of detailed neck ultrasound. I hope this demonstration will help you understand more about neck ultrasound and do ultrasound and enjoy doing ultrasound more and more, because ultrasound is a powerful tool in order to look at neck structures and disease. I hope you enjoy, and then see you later.